Here we have the project. Daya Foundation gets the authorization for the first legal medicinal growth of cannabis in Chile and Latin America. Here we have the official picture authorizing Daya Foundation for the crop. This is a small little sprout. Can you see it? That's the first legal sprout of medicinal cannabis in Chile near harvest time. Now the project was for compassionate use of cannabis oil as complementary medicine for the management of oncological pain in users in the healthcare centers of La Florida and beneficiaries of Daya Foundation. So for 200 oncological patients, 100 patients from La Florida, 100 patients from our foundation, we planted 425 plants in 7 months. They were harvested, and right now we are starting with the creation of the phytopharmaceutical of cannabis oil. This is the first phyto drug done in a region with a lab and with all the accompaniment of public health institutions in this state to lead to its registry. The implementation of the clinical study will be 2015-16, and here we've had the collaboration of the University of Valparaiso. With such news, which of course was seen throughout the world, we see how others see us. And several pieces of news, BBC, Chile is a pioneer in medicinal marijuana in Latin America. Chile starts the legal crops of marijuana. We also have French news and different images of the report in different parts of the world. Here we have some more images of the crops and of the plantation when it just started, some sprouts and other images, more and more. And here we have our growers, Carlos, Marcelo, Paola, and Pablo Melendez. They were in charge of this field with lots of love and dedication. I'd like to clarify that everyone that works in Daya Foundation works as volunteers. Nobody receives payment. We have worked like this for lots of years now, 20 people working all day long out of love and commitment to what we're doing with the purpose of alleviating human suffering. Here we see the drying chamber, the flowers that are ready to be delivered, opened up the seals in the lab where this is being processed. The second institutional project, the most ambitious we are working on, it groups 20 municipalities. Based on what we did with the municipality of La Florida, we had other municipalities in Chile contacting us. They wanted to replicate the same experience. So, learning from the first experience, we decided two things. First, that we had to take it out of urban areas and taking it to agricultural lands with better conditions, with no contamination and safer land. And we also realized that doing 20 smaller fields was more expensive and difficult to sustain and control. So we have found this model of having one large crop or field with 20 municipalities. Each municipality finances its share of that. It's like a club, and Daya Foundation is allied with the National Lab for Natural Medicine to create the phyto drug. The first one which we're working, and we're working with, they have the same view as we do of working with a full plant. We do not believe in fractioning it. We believe in the synergy effect or entourage effect, and that's how we like to work, and this lab works in that way as well. Based on that, Daya Foundation established alliances with public healthcare institutions for the design and conduction of clinical studies. The National Cancer Institute actually will be the one that leads the multi-center study of all patients involved in this second project we are developing. We believe it'll be about 2,500 oncological patients that will be participating in the clinical study. In the San Borja Hospital will be in charge of leading the clinical trial on refractory epilepsy that will have at least 200 cases. It means it'll be quite an important trial and considerable because of such a high number of participants. In the healthcare centers of each municipality, will look at patients according to the clinical trial protocols. This is the design we have now. coming back from Costa Rica, we have to start, admissions, because we have the commitment letters from the 20 municipalities, the Ministry of Health, the institutions. So we have managed to engage the Ministry of Health, the state, and we have kind of pressured it to this point.